99.9 KTDY, the best variety of the 80s, 90s, and today it is a Wednesday. That can only mean, it's 8:14, so that can only mean one thing. Dr. Kevin, the doctor, is in with the Bryant Wellness Institutes of Acadiana. Good morning, Doc.
Good morning. How are you guys this morning?
Good, thank you. This morning we're talking chronic pain, right?
Yeah, absolutely. August, we're having our Chronic Pain Causes and Solutions Month for the rest of August, and we're going to start a series of shows on natural solutions to chronic pain, and I'm going to reveal some of the details about how our drug-free pain relief program works and why it's been so effective. And you know, listen, guys, this is important. There are so many people out there that suffer with pain. It's a real problem, and not enough is being done to help these guys, help these people. And I wanted to do something extra to try to help these people that suffer with reoccurring pain. And as physicians, we need to continue to look for solutions that can better help these patients. And one reason that these patients aren't given other alternatives is that pain medication has gotten so strong and that it's an easy answer for practitioners to just sort of mask the pain. And ignore some of the other things out there that are available that could prevent the whole host of problems that comes along with pain medication in some cases. You know, the dependencies and overdoses and organ damages and all of those things could now possibly be avoided, but medication is kind of the easy answer. And it's gotten so strong that, you know, look, pain medication is stronger than it has ever been in the history of mankind. I mean, they can give you stronger and stronger medication until you just don't feel anything.
And that i.e. lies the problem. You don't feel anything.
Exactly. And the next problem I see is that patients feel sometimes like they're just doomed to a life of pain, like there's no hope. They feel like they've tried everything. No one can help them. Nothing is ever going to work to help them, and they've sort of lost hope. They feel like they've already been to specialist X, Y, and Z, and we're told that nothing could be done. And that is exactly the type of patient that we excel at helping. So if that's you, don't give up. Don't let somebody tell you that you're doomed to live life less than 100%. We're only given a certain number of days on this earth, and to spend them suffering is really a shame. It's especially a shame when natural solutions exist that might help you. It's a human tragedy that folks walk around suffering whenever they could be helped. But, you know, some physician somewhere told them that nothing could be done. Like one doctor could ever know the detail of what a result is going to be for every treatment in the world all at the same time. No doctor can ever tell you there's no hope for you, just maybe that their treatment can't help you. And no doctor can ever know how every treatment in the world is going to help one single patient. It's not possible. And so it's
Doc, would it be safe to say that also if a doctor says to you there's only one solution, you have to do this one thing, that's probably not right either.
Of course not. There are lots of things outside of traditional medicine that can help you. You know, it's sad when someone can be so conceited that they think that every treatment, that they know the results of every treatment and how that patient's going to respond to it, and this is the one thing that's going to help them, and they're the all-knowing. It's just nothing could be further from the truth. Don't take that as the final answer. There are people finding solutions to their suffering every single day outside of traditional American medicine. Every day, thousands of patients are living a better life using non-traditional treatments. In fact, millions of people every day are turning to non-traditional treatments, and they're getting more and more effective. And our drug-free pain relief program is really a combination of the most effective techniques in pain relief from all over the world. So what we're going to do is we're going to start a series of shows on some of these solutions to chronic pain. And then we're going to follow that up where I wanted to do an open house in my office to view these new technologies in action. We're going to do that on August 28th. So at the end of the month, we're going to have an open house so that the public can sort of see how each one of these new technologies work. And they can come in. We can sit down. I'm going to give them a little class on the benefits of each technology, and then we can walk them around and give them demonstrations of each one of these technologies and how effective that they are.
Question for you. You talk about chronic pain. Where? All over? What?
Yeah, and that's the other thing. A lot of patients that have chronic pain go, oh, well, he's talking about chronic pain. That's not me. If you've had pain for more than 3 months in duration, even if it comes and goes, you're a chronic pain sufferer.
So you're saying headache, backache, overall ache.
Right.
Whole body.
Rotator cuff tears, frozen shoulders, people with failed back surgery, people who don't want to go through back surgery that have tingling or sciatic or carpal tunnel or fibromyalgia. Pretty much any chronic pain can respond to these new methods because, again, we don't treat conditions. We don't treat the symptom. We treat the underlying causes of those symptoms. Mm-hmm. So it's not, people
getting down to the root of the problem.
Getting down to the root of the problem. Exactly right. And so any patient that has pain for more than 3 months in duration, even if it comes and goes, you have a problem. So don't minimize it. Sometimes patients minimize their problem. Well, maybe it'll go away. It's going to get better. It almost never gets better. The longer you wait, the harder it is to fix. So what happens whenever you ignore problems? They get worse. They don't get better. Mm-hmm. If your house is dirty and you ignore it, what happens? It gets worse. Mm-hmm. If your kid's doing bad at their homework and you ignore it, it's going to get worse. And so you have to face problems head on. And chronic pain is no different. And so what we'll do after the break is I'm going to discuss some of the solutions, and we'll sort of break this program down and show you why our program is so different than everything else out there.